to carry the cure for someone's cancer. All of us are carrying the cure for someone's cancer in our magical cells called stem cells. It will be ideal to share it. Talking about the organization, see, always when we talk about stem cell donation, there might be many people around the world who would like to donate their stem cells, but they don't know where to go about. And the thing is, a stem cell donation can take place only with that patient and you, if you're a perfect DNA match. You must have heard about DNA, and it is very unique for every one of us. All of us have a very unique DNA, and we feel that it never matches with anyone. It's not completely true. There is a tendency that you will match on a random basis with someone, but very, very rare. So this registry helps in finding that rare match. So Marrow Donor Registry was formed in 2009 with the hope, that we can help such kind of cancer patients. Of course, we have to start somewhere, and it started as an initiative from the Tata Memorial Hospital, the cancer hospital in Parel, where I was working as the blood bank officer in 2009. And we started registering voluntary donors who would like to pledge their, stem cells for such cancer patients. They can be called if they are found as a match. So we started in 2009. We started under the Tata banner, and the Tatas were very kind to help us out with the funding project, because this project needs a lot of funding, and they were very kind to help us. And the project started with a bang. So as I said, the problem statement. Many of us would like to donate, but we don't know where to find the patient, or the patient will not be able to find us because we are very rare match. So we have a repository, and we started registering donors. So there are many cancer patients around the world diagnosed with leukemia, thalassemia, genetic blood disorders, where the only hope for them is a stem cell donation, from a donor like you. And as you know, the recent statistics says that 1 lakh cancer patient diagnosed every year only in India. And the best possible cure for them is a stem cell transplant from a donor like you. So the stem cell donation should come from a person or a donor who's a complete DNA match. So we try to match, of course, with the sibling. There is always a tendency that we will match our sibling, your own brother or sister, not your cousins or, a distant relative or someone. That also, there is only a 25% chance that you will match with your own sibling. There is a 75% chance that you will not match with your sibling. So then again, the only hope for such patients is to look forward to a registry where there are already donors who are waiting for the call to come forward and donate for such patients. And the matching probability, as I said, is very, very rare. It's almost 1 in 20,000 to 1 in 50,000. So that becomes very, very rare. And till 2009, there was no registry at all. We were very late to form a registry. Our country was lagging behind. There are many countries around the world who have huge registries. They started in the 1970s and 80s. And they have more than many lakhs. The US has more than 2 crore donors with them. And we started registering donors. So how to solve this problem? The only solution is to have a huge registry with a repository of many donors who are already, registered with us. Their DNA is tested and ready to be matched with patients whoever come looking for a match. As I said, the sibling is the first hope, but nowadays, many families follow the single child norm. So if the child is diagnosed with a, threatening blood disorder, then the only hope for them is to directly approach a registry and go forward. As I said, the possibility is 1 in 20,000, but it's not impossible. So people who are willing to donate should enroll themselves into a registry and wait for the call. So we have a centralized registry, and they will have to be registered with us so that the patients can approach us through the doctor. The treating doctor can approach us, and all this is free of cost. We have an email, we have a phone call. Within a day, we respond to them saying that there is a donor or match found, and we can take it forward from there. So as a registry, what is our role? MDRI took the responsibility of registering voluntary donors, to save such lives. So how do we enroll themselves? We just cannot call one donor and tell them to register themselves. We'll have to give them an awareness session, like, how, like I'm talking today, we'll have to give them this talk and let them know that, you are going to enroll yourselves now, but you might be called later when you are found as a matching donor with a certain patient. And that time he should come forward to donate also. And this can take place anywhere from today for the next 40 years. Whenever they are found as a match, they'll be called. And it won't be an emergency call, of course. They'll be informed that they've been found as a match, and they'll be given some time to decide if they want to go ahead, because this is a totally voluntary act. Okay, the donor's choice is the final choice, that if they want to donate or not. So how does the donor register themselves? So they fill up an enrollment form with their contact details, keeping in mind that, the next 30-40 years, this is the only detail we have to register themselves and to reach out to them. And to do their DNA test, of course, because that is what we need to see if they match with the patient. So we used to take blood samples before. Now we take saliva sample. Okay. As technology gets advanced, we can take a saliva sample and do the DNA test of the donor. It's a simple 1-minute procedure where the donor has to just do a swabbing and send us the swab kit, and we do the test, and he's already registered with us. The donor will be acknowledged with the donor card, which is a globally recognized donor card, so that they don't register in every registry around the world if they move on. So it's called an HLA test, the human leukocyte antigen test, because that is a specific test which is required to see if the donor matches with the patient. So the HLA report is uploaded on our database, and the donor is kept anonymous. They are anonymized, only known by numerical data. No donor is known to even our staff. Okay, so that there is no bias of selection of donors. So these donors are regularly checked to see if they match with any patients, because we receive many patients looking for matches. We have registered with all the hospitals, not only in India, but around the world. And we receive about 10 patients every day looking for a matching donor. 10 new patients. Okay. So that is the statistics of the number of patients around the world. Yeah. So how does the enrollment take place? So the initial counseling session will take place on a day prior to the camp, where the donors are given the full information on how they can register themselves as a stem cell donor. And I go class to class in a college or floor to floor in an office and talk to them and give them all the information. Then we have a question answer session where they can, answer all the questions on all the myths, facts they would like to be revealed. And they will be more comfortable to go back home, read about it, Google it, and then come back the next day only if they are interested to be a registered voluntary donor. So they'll fill up a consent form, they'll give their full contact details, and the saliva sample will be given. And finally, if you can see that last image, it's the donor card that will be shared with them by post. Yeah, so to register as a donor, what is the requirement? Both genders are equally welcome. They always feel that, male, female and all that. There is nothing like that. All are absolutely welcome. You should be between the age of 18 to 50 years, and your weight should be around 50 kg or more. Okay, because we cannot register donors below the weight of 50 also, because there is a certain amount of blood volume in our body depending on our weight. So that will decide how much stem cells you would have on the day of your donation also. So we would prefer the donors to be above 50 kg. And of course, you should be in good health with no major diseases, of course, heart disease, kidney disease, liver disease, or cancer itself. So otherwise, all are welcome. You might be on medication for something, but that is not a deferral criteria. That you might be on medication for blood pressure, diabetes, and maybe you might be having medication for migraine or some other kidney stone or something like that. These are all minor factors which should not keep you away from registering as a donor. And of course, you should have the willingness to come forward the day you are found as a match, because it is always seen that when we do massive camps in colleges, the whole college is very enthusiastic about it and everybody wants to register. But they might have second thoughts the day they are found as a match, maybe when we call them 10 years later. So the commitment should be always your top priority whenever you are called. Of course, the donor doesn't have to pay anything. It is done absolutely free of cost. All expenses for the testing are borne by us, and which is funded by the donation from corporates and individuals. Sadly, we don't have a government support yet. So the Tatas are taking care of the whole project. So there shouldn't be any problem for the donor also. Yeah, so coming to, when a match is found, say you're already a registered donor with us, you've received a donor card, and it's been almost 5 years that you never got a call. Suddenly one fine day you might get a call from us saying that, you've been found as a match with someone, and would you still like to go ahead with it? Because we will not let you, come forward and donate immediately. We will always take a consent again, because since it has been a few years back that you had registered with us, we would like to know your health status also. There might have been some changes in your location or your health status. So we would always take a consent again to see if you're still willing to donate, and you have to pass something called a fitness for donation also. And we'll confirm that you are that same donor who's been found as a match. We'll take another sample, we'll send it to US, get a confirmatory testing also. So the donor donates his stem cells in a simple outdoor procedure. Okay, the donation is a very simple process. It's a needle procedure. I'll explain all that in some time. There is always a fear that stem cell donation, bone marrow donation, painful procedure. I know I want to help a certain patient, but it's always that will I undergo any change in my health condition? Would I have any side effects to the procedure? Will I have any permanent residual disorder in me after the donation process? So there is nothing like that. You are going to donate something as simple as a blood donation and nothing more. Whatever you donate will be replenished soon in your body. So the donor will be, so if he's selected as a donor, he'll undergo a health checkup. He'll have to pass something called a fitness for donation. And it will be a blood test with an ECG, an X-ray chest, and an ultrasonography abdomen. And we'll certify him fit if all the reports are normal. If at all there is any change in his health status, we would tell him that you might not be able to donate. Or if it's a temporary factor, we can delay the transplant. We can take care of his health status first and then take the donation from the donor. So the simple process is that, as I said, stem cells is something very new. To come to the main part, what are stem cells? Stem cell is just blood. Okay, it is the immature blood which is encased inside your bone marrow. Bone marrow means the hollow part of your bones where your blood is being formed every day. Some of you all might not know that. Okay, the immature blood which is formed inside the bone marrow will slowly overflow into your blood every day. As our cells get destroyed every day, used up, new cells are being formed by our bone marrow, and that's how our blood is always active and getting regenerated again and again. So these cells which is inside the bone marrow, that is what is the patient requires. So previously, about 30 years ago, actual procedure was we had to go into the bone with a huge needle and remove that bone marrow and give it to the patient. Of course, due to advanced technology and all, that procedure is not done anymore. It is as simple as a blood donation now. You will be donating your stem cells as simple as a blood donation. That's why we changed the name as from bone marrow to stem cell donation. Okay, we don't use the term bone marrow also. Because we don't want to scare the donors actually. So it's a simple process. We call it stem cell donation. So how does it work when the stem cells are inside the bone marrow? How does it come outside into the blood? So there is this special wonder drug called growth factor, an injection which is given under the skin, a very painless one, a tiny injection. I will be coming personally and give it to the donor on his tummy 5 days before the procedure, one on each day. So what happens is it's a stimulant basically. It will stimulate your bone marrow. It will signal your bone marrow to produce a few more cells, and the cells will increase in your bone marrow, and there will be a point where it has saturated and it will come into your bloodstream. You will not know anything. Okay, slowly I'll come every day, check you, and I'll see that the number of cells are rising in your blood. So by the 5th day, the required cells are into your blood. So there is about a 20% rise in the stem cells in your actual peripheral blood. That is the day you will have to come to our blood bank and donate your stem cells. Yeah, so this is the donor who is actually donating his stem cells. As you can see, he's comfortably lying down. He's smiling also, and obviously he's not in any pain. So 5 days before the injections have been given, and the collection takes place on a machine on which a kit has been installed, and the kit has 2 needles. One needle goes in each arm. So the blood will come out of one arm, it will go into the kit, it will separate out the stem cells, and the remaining blood will be returned back to you. So there won't be any blood loss to the donor also. So at the end of the process, only 200 ml of blood is collected, which is rich in stem cells. It looks like blood only. Okay, if you all have been through a blood donation, you see a blood bag. It's a red color tiny bag. Blood donation is 350 to 450 ml. This is only 200 ml. that is enough for the patient. So donor is at absolute comfort. The only thing is that the collection takes place very slowly so that the donor is absolutely comfortable. So what he'll have to do is he'll have to just lie down and watch TV, nothing more. Okay. And at the end, just 200 ml of blood is collected.